Hello doctors, welcome back to my channel Asan Network Ortho. I am your Dr.Salauddin, MBBS MS Orthopaedics, and this is our fracture classification series. So the next important bones that in our fracture classification series we are discussing is the lower limb bones. We are starting with the femur, that is proximal femur. So in the proximal femur, this is the head region, this is the neck, this is the trochanteric region, and this is the subtrochanteric region. Today we will be discussing about the head and the neck fractures. Okay, we will be discussing the trochanteric and subtrochanteric fractures in the next video. So in the proximal femur, first is our femoral head fractures, and the classification name for the femoral head is Pipkin's classification. Okay, so what are the types of Pipkin's classification? There are 4 types in the Pipkin's classification for femoral head fractures. Type 1 is the fracture of the femoral head below the fovea capitis. The fovea capitis, it is the non-weight bearing area. Okay, below the fovea capitis is the non-weight bearing area. So if the fracture occurs, it is type 1. If it is occurring above the fovea capitis and it is the weight bearing area, it is type 2. Okay, so below is type 1 and above is type 2. Any of these fractures, if it is associated with neck fracture, it is type 3. Any of these type 1 and type 4 fractures associated with acetabulum fractures, it is type 4. Usually it is the posterior wall of the acetabulum that gets fractured. Okay, so you can see in the images. So the fovea capitis is nothing but the area where the ligamentum teres gets attached to the femoral head. So if the fracture is occurring below the attachment of the ligamentum teres, here it's a non-weight bearing portion, so it comes as type 1 of Pipkin's classification. So if the fracture is occurring above the fovea capitis, it's a weight bearing portion, it's a type 2. So if head fracture associated with the neck fracture, it's a type 3, and if the head fracture is associated with the acetabulum fracture, then it's a type 4. Usually the posterior wall of the acetabulum is getting fractured. So this is the Pipkin's classification for femoral head fractures. Here is the AO classification system. So in AO classification system, what is the number? As we have discussed in the early videos, AO is an alphanumerical classification system. So what is the number for the femur? The number for the femur is number 3. For the proximal femur, that is the head, neck and the trochanteric region, he gives the number 1. So 3 is for femur, 1 is for proximal region of the femur. Okay, and here in A, B and C, A is the trochanteric region. So the trochanteric region is A. He comes from below to above. Okay, so A is trochanteric region, B is the neck fractures, and C is the head fractures. Okay, so head fractures come in type C of AO classification. So 3-1C means it's a femoral head fracture. Okay, 3-1B is it's a neck fracture, 3-1A is trochanteric region fracture. So coming to 3-1C, that is the femur head AO classification. So 3-1C has again 3-1C1. 3-1C1 is split fractures. Okay, so split fractures of the, in C1 also it has C1.1, C1.2 and C1.3. So what is splitting is, first is avulsion of ligamentum teres. Only the ligamentum teres part is getting avulsed. It is C1.1. Okay, C1.2 is split infrafoveal fracture. the part below the ligamentum teres is getting avulsed, so it is C1.2. If it is getting above, that is suprafoveal, it is C1.3. okay, this is simple C1 split fracture. Then coming to C2 is the depressed fractures. The depressed fractures, the chondral lesion, it is C2.1. the weight bearing portion of the cartilage is getting depressed, it is an C2.1. if it is depressing and impaction fracture, it is depressed and an impression has been made, it's C2.3. depression with an impaction is C2.2. then split depression fracture, there is a split and also there is a depression, then it's C2.3. okay, coming to femur neck fractures. Can anyone tell me what the classifications, different classifications are there? In UG you would have regularly read, and it's an 10 marks question for you as a long question. You would be knowing, that is, first is your anatomical classification, then you would be definitely knowing Gordon's classification, and also you would be knowing Pauwels classification system. Here one more classification we would be learning is AO classification system, and few intraoperative lines that we need to remember is Lowell's lines. These 5 things about the neck of femur classification we need to know. So what are the classifications? That is anatomical classification, Gordon's classification, Pauwels classification and AO classification. What is the femur neck in AO? Just now we learned it is 3-1B. 3-1B is neck in AO classification. So based on the anatomical location, so anatomical classification is based on the location of the neck. Gordon's, what it is based? Gordon's is based on displacement of the fracture on the X-ray in only AP view. The flaw in Gordon's classification is he considers only AP view of the X-ray, AP view, that is the flaw in the Gordon's classification. So he considers the displacement of the fracture fragments. It is Gordon's classification. What is Pauwels classification based on? It is based on the angle, inclination angle of the fracture line with respect to the horizontal. That's a very important line. This you have to remember. We will be discussing and seeing in the X-rays. Okay. So what are the locations? This is an anatomical classification of the femur neck. Immediately below the head, just immediately below the head, if the fracture is occurring in the neck, it's a subcapital. Just immediately below the head. Capital means capitate, in other sense is head, sub is below. Below the head is subcapital. If it is occurring in the base of the neck, this is the base of the neck, it is basicervical. Cervical means nothing but neck. So base of the neck fracture is basicervical. If it is occurring through the neck, middle, in between middle, through the neck, that is transcervical. Trans is through, cervical is neck. So through the neck is the transcervical fracture. It's a very simple classification. Below the head subcapital, through the neck it's transcervical, and it's, if it is going through the base, it is basicervical. One little confusing part of this classification is the basicervical we can't differentiate if it is occurring at the level of, just till at the level of the intertrochanteric area region. So sometimes a simple intertrochanteric fracture and a basicervical fracture may be correlating. So the treatment part also varies in the basicervical fractures. Sometimes some basicervical fractures are considered as neck of femur fractures and they are treated accordingly. Sometimes a basicervical fracture is considered as an intertrochanteric fracture and is treated differently as an IT intertrochanteric fracture. Okay. The next classification system, that is the Gordon's classification system. It has 4 types based on the AP view, X-ray and the fracture displacement, whether the fracture is displacing or not. First is, if the fracture is incomplete and it is an valgus impacted fracture. This is a very important line, valgus impaction. See, you cannot see any displacement in the first type. It's an incomplete fracture and the fracture is valgus impacted. It means even if the fracture has happened and undisplaced, the proximal fragment may be within the canal of the femur, so that the fracture is not moving at all. So it's an type 1 type of Gordon's classification, and it's an stable fracture and it has good union rates and it has the lowest chance of avian. Now suddenly why avian has come into the picture? You will be knowing and you should be knowing that avascular necrosis is the most common complication for neck of femur fracture. Okay, another most common complication for neck of femur fracture is non-union. Okay, the first most common is non-union, then the second most common is avian, first is non-union. Okay, next, second is complete fracture of the neck but undisplaced. Here it has incomplete fracture, second is undisplaced complete fracture and it is still stable in the radiograph. And if reduced properly and fixed, avian is moderate risk. Okay. Third is partially displaced fracture, that is the trabeculae are partly aligned. The head and neck region is partially displaced, still the trabeculae are aligned, but it's an unstable fracture and there is higher chance of avian and non-union risk when compared to type 1 and type 2. Then type 4 is the completely displaced and no trabeculae are in continuity with each other. This is also an unstable fracture and this has the worst prognosis in because of higher avian and non-union rates. So as you can see in the images, here it's an undisplaced fracture but a complete. Here the type 1 there is incomplete fracture. Then stage 3 is there is a partial displacement but some trabeculae are aligned. Still it's an unstable fracture and moderate risk of avian is present. Here there is complete displacement of the fracture and higher chance of avian and non-union is present. So Gordon gave some alignment index for intraoperative management. So in an AP view, when you see in an AP view, the neck shaft angle, this is the shaft. Okay, the neck shaft angle should be of minimum 160 degrees and in the AP view, and in the lateral view the alignment should be perfectly 180 degrees. Okay, if it is not 180 degrees, it's not acceptable according to Gordon's alignment index. Okay, and in AP view it should be minimum of 160 degrees of neck shaft angle according to Gordon's alignment index. The most important intraoperative signs are Pauwels S-shaped curves. Inside the operation theatre, you see these curves and these curves should be maintained. Okay, in the AP view there is an normal S in the upper part and a reverse S in the lower part, and curved S-shaped normal S and a reverse S in the lateral view. Also these S should be maintained. If one of these S-shaped curves are not maintained, it's an improper reduction. Okay, you have to do the reduction once more to maintain this levels S-shaped curves, then only the fracture may unite. Okay. Now coming to Pauwels classification system, it's based on the angle between the fracture line and the horizontal. So type 1, when the fracture line is making an angle of less than 30 degrees. Less than 30 degrees is type 1. If the fracture is, you can see the fracture line, this is the fracture line. As you progress from type 1 to type 3, the fracture line is becoming more vertical. Okay. So what Pauwels wanted to say is, if the fracture line is horizontal, then there are more compressive forces acting at the fracture site and the fracture may unite earlier. Okay, the fracture line should be more horizontal. When it becomes more vertical, there are more shearing forces, and this will cause displacement of the fracture fragments. Okay, when the fracture line is more vertical, that is if it is going from 30 to 50 degrees, increasing the fracture line angle, then there are more shearing forces and more displacement chances, and there are higher chances of displacement, then there is higher chance of avian and non-union. Okay, this is an important point given by the Pauwels classification. Next, the AO classification system for neck of femur fracture. As you can remember, 3.1b is the neck region. At what points does he define? That you have to see. See, neck is defined at the line drawn at the distal extent of the femoral head articular cartilage. This is the distal extent of the articular cartilage. Then the intertrochanteric line distally. Here the intertrochanteric line distally, and this is the distal most articular part, and subcapital or femoral neck fracture lines. Okay, this is the intertrochanteric line, and this is the distal most cartilage points that has been united. Okay, so this is the neck region defined by AO. What is the head region defined by AO? The portion proximal to the segment covered by articular cartilage. This is the articular cartilage distal most points, and segment that has been covered above this region is the head region, and below the transverse line inferior border of the lesser trochanter, here the trochanteric region to the trochanteric region and the inferior border of the lesser trochanter. This is the lesser trochanter and this is the inferior border. Through this the transverse line, this region is the trochanteric region according to the AO classification. So AO classification 3.1b neck part, we will be seeing the classification. So 3.1b, 3.1b1 is subcapital. Simply in AO you can remember, see, AO combined all the three classifications, the anatomical, Cordens and Pauwels classification. Simply it combined all the three and it gave different numberings for each of the classification. Okay, simply you can remember B1 is B1, B2, B3, they are anatomical, subcapital, transverse and basis cervical. Okay, B1, B2, B3. In B1, each B1, B2, B1.1, 1.2 and 1.3, each one is an Gardens classification. See, B1.1 is, what is Gardens type 1? It is incomplete valgus impacted. Similarly, here 1.1 is valgus impacted fracture. So this is B1.1 valgus impacted according to Gardens type 1. Then 1.2 is according to Gardens type, it is a complete fracture and an undisplaced fracture. See, here also it's an undisplaced fracture, B 1.2. What is type 3? Type 3 in Gardens, it's an displaced fracture, but some part of the trabeculae are aligned. Here also it's a displaced fracture, it is B 1.3. So B1 is simply anatomical subcapital type. Each of the B1 type is Gardens 1, 2 and 3 types. Clear? Next, B2, as I told you, anatomical. B2 is transcervical. Transcervical. In within B2, each of the type, he gives different fracture fragments. The mid portion of the neck, simple fracture is 2.1, multifragmentary is 2.2 and a shear fracture is 2.3. Simple fracture 2.1, multifragmentary 2.2 and a vertical shear fracture. Vertical shear fracture is, it's a B 2.3. One more classification that has been added within the 2.2 is Pauwels classification. They gave it as qualifiers, that is they add small alphabets for Pauwels classification. So B 2.2 Pauwels addition is nothing but giving codes P, Q and R for making an angle, the fracture line making an angle with the horizontal. See, the fracture line making the angle with an horizontal, if it is less than 30 degrees it's P, 30 to 70 degrees it's Q, more than 70 degrees it's R. According to original Pauwels, it was 30, 30 to 50 and more than 50. They changed this number 50 to 70 degrees. Okay, it's as simple as such. It is B 2.2 Pauwels addition given as the qualifiers code P, Q and R. Simply Pauwels classification is added. Next, B3 I told you, it's simply anatomical basicervical type. It's a basicervical fracture is B3. Okay, now we will go into the X-rays of each of the neck of the femur classifications. Now you tell me what type it is. Anatomical, Gardens and Pauwels. Where is the fracture? The right side of the neck is fractured here. For getting a good X-ray, see here you can see in the left side, left X-ray, you can see the full portion of the neck, right, from the, immediately to the head, below the head and to the trochanteric region. This portion of the neck is you are visualizing, but on the right side you are not able to visualize this whole region, right, that has gone posteriorly or something has happened in the X-ray, but you are only able to visualize this much portion only. Why this is occurring? Because whenever the neck of femur fracture happens, clinically you can observe there is an external rotation deformity occurring. You would have read the lateral border of the foot rotated externally but not touching the couch. Yeah, this you would have read in the books. What happens is, when the foot is externally rotated, whole of the lesser trochanter will be visible. Neck portion is overlapped with the trochanteric region. So what you have to do is then to get the full profile of the neck, that is like this in the left side. If you want to see in the right side also, you should get an traction and an internal rotation of 15 degrees. Traction and internal rotation view of 15 degrees in the AP view, if you get, then you will be able to visualize the profile of the neck and you will be definitely knowing what region of the neck is fractured according to the anatomical type you can be seeing. But here it's little difficult, but still you can manage to see. It's fractured at the subcapital region. Okay, it's fractured to the subcapital region. Now according to the Pauwels, how much angle it is making? It's almost more than 50 degrees. So according to Pauwels, it's more than 50 degrees. It is type 3 of Pauwels. According to Gardens, whether the fracture is displaced or not, it's a complete fracture. One thing is, according to Gardens, it is a complete fracture. If it is a displaced or undisplaced, it's a partially displaced fracture. Some amount of the trabeculae is still aligned. Okay, it's a type 3 Gardens classification. Now in this X-ray, here also there is the same problem. See, the profile is not visual, lesser trochanter is fully visual, traction internal rotation is not there, but still the fracture is going here. Okay, and head portion is also visible and the fracture is going here. If you give a traction and see, it would be appearing it as an trans cervical fracture. It's a trans cervical fracture according to anatomical classification. What is the angle now it is making? It's around 30 to 50. So it's a type 2 of Pauwels. It's type 2 of Pauwels. Now what it is according to Gardens classification? So it's a complete fracture and there is displacement. It's a completely displaced fracture. Still there are no trabeculae that are aligned according to the Gardens type. So it is a type 4 of Gardens classification. Okay. Now you can see here what type this is. Yeah, the whole neck region is available here and the trochanteric region is fractured here. Near the trochanteric region it is fractured. So this is an cervical fracture. It's a cervical fracture. The fracture is making an 30 to 50 degrees angle in between. It's a type 2 Pauwels fracture. What type of Gardens it is? It's a displaced complete fracture and a displaced fracture. It's a type 4 Gardens fracture. Okay. What type of AO anyone can tell? AO. Simple. It is 3-1-B-3. 3-1-B-3 is cervical fracture. Okay. Now here it's clearly visible. It's a what type it is? It's a this is the foveal region, capital region, and this is the articular area. Okay, and this is the cervical part. It's a trans cervical fracture. The fracture line is making more than 50 degrees. It is type 3 Pauwels and Gardens it is. Tell me what type of Gardens it is. Yeah, this is a complete fracture and it's mostly undisplaced fracture. It's not displaced much. Complete undisplaced is type 2. Now tell me what type of AO classification it is. So trans cervical comes as B2, right? In B2 what type? B2.1 is trans cervical. B2.1. B2.2 is Pauwels additions, right? B2.3 is shear fracture, shear vertical fracture. So this is not B2.3. Okay. Here B2.2 is it's a multi-fragmentary fracture. 2.1 is a simple fracture. Is it multifragmentary? No, it's a simple transcervical fracture. So it is B 2.1. Okay, it's a B 2.1 AO classification. Now you tell me what type it is. Here you can see multiple fracture fragments. Here. You can see different multiple fracture fragments. Right. So this is a transcervical, but there are multiple fracture fragments. So this is a transcervical fracture, but multiple fracture fragments. So it's 2.2. Okay, that is Pauwels addition. Pauwels addition. Now you have to tell me the angle. Okay. So the angle is, it's less than 30 degrees. So it is code P. PQR. P is the code for less than 30 degrees. Okay. Pauwels code P, type 2.B 2.2. Okay. Gardens type. What type of Gardens it is? Gardens, it is completely displaced fracture. Complete displaced fractures, and it's an unstable fracture. There are no fracture trabeculae. There are no trabeculae aligned. It is a type 4 Gardens classification. Anatomically, it is transcervical. Okay. What type it is now? It's a subcapital fracture, but here it is partially displaced, and some amount of trabeculae are aligned. So some amount of trabeculae aligned. It is type 3 of Gardens. What type it is in AO? AO, it is subcapital is simply B1. Okay, B 1.1 is simple, it's Gardens, undisplaced, displaced, valgus impacted, undisplaced and displaced fracture. This is an partially displaced fracture, comes as type 3, B 1.3. Okay. So this is another X-ray. What type it is? This one is an homework for you. You can comment in the comment section what type of fracture this is. In the comment section you can comment it. Okay. Thank you, doctors. Please subscribe and like and share to my Asan network, and be updated in your fracture classifications, and be confident in your clinical rounds. Thank you.